Welcome back, everybody. Dr. Blumenthal here with Natural Transplants. We are in the Bethesda office, and we are excited to have Kashif today. Welcome, Kashif. We're from Delaware, is that right?
That's right.
Awesome.
Thank you so much.
So thanks for having us, or thanks for coming. Thanks for doing this for everybody. Hopefully this will help somebody and inspire them as well and educate them. If you wouldn't mind just quickly catching up, catch everybody up on how you found us and why you're here today.
So I found you through Facebook, through your advertisement on Facebook.
Okay.
I did my own research, looked up on your videos, also tried to compare it with other modes of treatment for hair loss. And I found this method to be the most appealing to me.
Okay.
I thought it can get me the most density and seems much more logical in a sense to me. So that's why I chose your method.
Great.
And that's basically how I found it.
Yeah, excellent. And we're going to try to get the plus today, so we're going to try to get as much hair as we possibly can. And I'm going to have Ron zoom in here, and so you can see you're probably on the on the Norwood scale in the 5 to 6 range. We still have some hair in the bridge, and we're going to go over what our priority zones are today. But we're going to try to get as much as we can, if possible, to fill in the whole area. Although that's in general hard to do. The other option would be we could fill in the frontal third, skip the bridge, do the crown, or just go from the front as far back as we can go. But we did talk it may be difficult to fill in the whole area of loss in one procedure, which typically it takes 2 at least to fill in the whole area. But we're going to do our best today, try to get that plus done, and kind of go from there.
Sounds good.
All right, excellent. So we'll do a little bit of drawing, a little bit of shaving, and we'll check back in and see the line. Okay. All right. Thanks again for doing this. We'll check back a little bit. Okay, everybody, we are back with Kashif, and as you can see, we've drawn the lines out here, and I'm just going to show the lines what we're going to do. So again, a nice, reasonable line, something that's age appropriate, that's going to look good. We're not trying to overdo it and bring it down too far to make them look 18 again. That's not what we're trying to accomplish today. And so what we thought was a nice, reasonable, good-looking, age-appropriate line. Also, the lower you go, the more hair you're going to use down here, the less hair you will have up top. So we thought this was a reasonable spot. We're going to just go from the front, work our way all the way to the back as far as we can go. If we hit a home run, maybe we can go all the way through, but I anticipate we'll probably get into the crown, but probably not all the way through the crown. But again, we're going to do our best to get our plus and get as much as we can. How you feel?
I feel okay.
Doing okay? So we're not doing any Valium today. Kashif is kind of a mellow guy as it is, so no Valium today, so we're going to give that a go. We're going to head next door and start the numbing medicine and start the procedure. We'll check in a little bit later in the day with you. Is that good?
Sounds good.
Awesome.
Yes.
All right, we'll see you in a little while. All right, we are back with Kashif. Kashif, how you doing, man?
I'm doing well.
Doing okay?
Yep.
So we've taken the strip out, strip's been cut up, we've placed all the slits, and now the techs are placing all the hairs within the slits. And we probably have about 20 more minutes, 30 more minutes to go, something like that. You having any pain?
No, not really.
Good. Okay. Just sitting, relaxing, watching second movie of the day. We already had lunch. You have not dozed off that I've seen, but if that happens, I'll let you know. But otherwise, it looks good. Like I said, we have about 30 more minutes to go, and then we'll catch up with you at the end and see the final results. All right? Awesome. See you soon. Okay, we are finished. We are back with Kashif, and we are done for the day. Congratulations. It can be a long day. We did the plus. We were able to successfully get the plus. We got a lot of hair. How'd the day go?
It went very well.
And you can be honest. You can say the good and the bad.
No, it went very well.
Yeah.
I didn't have any problems.
Good. You handled the anesthesia great. You really didn't have any problems with the anesthesia. That oftentimes is the hardest part with the local anesthesia all the way around. But you did fantastic with that. Like we said before, watched some movies, ate some lunch.
Yeah.
Nice relaxing day, hopefully. Yeah.
It was fine.
Good. You got a lot of hair. So I'm going to have Jeff zoom in here, and you can kind of take a shot at the front hairline. Obviously, there's some swelling going on, but we packed it the first couple rows with the tiny little 1 and 2 hair grafts. Everything behind has the 3, 4, 5, even 6 hairs in each graft. I'm going to spin you around a little bit here. And we were not able, like we talked about, not able to get all the way through the back, but we got through about half of the crown and left sort of in a spiral. towards the end, and then the incision in the back. The hair's long enough you can't really see it, but once some of that shaved hair grows back and the stitches are out, that shouldn't be an issue. It's a nice tiny little line at the end of the day once the stitches are out. So it looks great. Awesome. Well, thanks again for doing this and sharing your story with everybody.
Of course, yes, thank you so
Hopefully we can follow you along over the year and get the final results a year from now, and have your new hairline and everything looking good.
Yes, definitely.
Appreciate it. Well, welcome to the family, and hopefully we'll check in with you within the next year or so and follow along.
Sounds
all right. Awesome. Appreciate it.
Thank you so much.
Take care.
Call us now, 844-327-4247, and ask about our Hue and Hue Plus procedures, which move more hair than ever before. Hope to hear from you soon.